Hi, so let's talk about congenital heart defect screening. So this is one of those tests that gets done in the newborn period in the hospital. This is something that pediatrician can also do in their office if the baby is born at home. So it is called the CCHD, which is Critical Congenital Heart Disease Screening, and it is really simple to do. It involves a pulse oximeter. We've all heard of those recently. And so a pulse oximeter just measures the oxygen level. So there's a probe that is put on the baby's right arm, or right hand rather, and on their right leg. And they are just being measured the oxygen level for the right arm and the right leg. And if it is greater than 95%, we are good to go. And there should not really be much of a difference between the right arm and the right leg. And if it's more than a 3% oxygen level difference, then that just needs to be repeated about an hour or two later. So this test is usually done within the first 24, 36 hours after the baby's born. And what has been really important about this is that when this testing was implemented, the rate of detection of the congenital heart disease, or that is critical, was detected very early, and it reduced the deaths and complications by 33%. So it's a super easy test, worth doing. So coming back to the numbers again, if it's greater than 95% the oxygen level in the right arm and the right leg, then we're good to go. If there's a minimal difference between the right arm and right leg of less than 3%, then we are also good to go. But if there's any oxygen level that is less than 90%, or if there is a greater difference between the right arm and the right leg of 3% or more, then that suggests that there's probably a heart defect of some sort, and that needs to be evaluated. And the baby will then have a cardiologist involved, and the intensive care unit will be involved if they're at the hospital. And this is just an easy thing to do, and it detects those heart disease things that can be very critical and need to be addressed right away. So if there's any questions, please put them in the comments. We're happy to answer them, but just wanted to give you a heads up as to what that is all about.